here today, and your attention to and dedication is impressive. I've never sat before one of these today, and good for you guys. Basically, I am a volunteer with the Texas Organizing Project, and I'm a recently retired physician who's practiced in Texas for 30 years. I'm an ear, nose, and throat doctor, and most of the patients I see are rather straightforward: earaches, sore throats, allergies, sinus disease. Occasionally, a sore throat doesn't get better, and on exam, you see a little area that's just not right, and an in-office biopsy we can do easily, and unfortunately, some of these come back as cancer. Now, found at this early stage, typically as an ambulatory care, we can do a wide excision, and they have a 98-99% cure rate. Now, unfortunately, the person without health care doesn't come in early. These lesions inside are bigger. They now go to the base of the tongue. They have neck nodes. And what results is in recurrent hospitalizations, surgeries, radiation, chemotherapy, and cure rates now drop into the 40-70% range. Their bills are insurmountable, and there's no way possible that they can do them. John Peter Smith Hospital gets 35% of its revenue from property tax. In 2015, John Peter Smith had an uncollected debt of $109 million. The correlation between property tax, indigent care, and hospital debt is direct. Parkland had $500 million of uncollected debt. Senators, why I urge you to support the federally expansion of Medicaid. Not only would it give much-needed health care to over 1 million Texans that fall in the coverage gap, 74% of these folks work. 51% are women, 16% are children, 47,000 are veterans, 20% have mental health issues. But the state of Texas would receive over $100 billion from the federal government over the next 10 years. This would create 300,000 jobs. Now, closing the coverage gap in the Medicaid in Tarrant County alone, the gap is the difference between what being currently eligible for Medicaid and being able to make enough money to get tax credits for the Affordable Care Act would create, if we expanded that, or expanded the gap, it would create 24,000 jobs in Tarrant County. It would pump in $323 million in new health care dollars into the community.
I appreciate it.
Mr. Chairman.
We're not over time. We have a couple of comments. Senator Perry.
I appreciate your testimony. Number one, this isn't the forum, but number two, there's a theme, and I don't know who's producing.
It is.
No, sir.
Okay.
No. What's not being said in that narrative is a couple things. One, we're $20 trillion in debt and climbing at the federal government.
Say that again.
$20 trillion in debt and climbing at the federal government. So the advocates advocating to hitch our wagon to a sinking ship already doesn't make any sense to Texas. Secondly, those that have done it are getting out of it. Unfortunately, they're locked into it. The exchanges are failing. The Medicaid expansion states are finding out what Texas knew. There were 750 to 1 million people that would come on our rolls that were not going to be reimbursed under what was being advocated because they were, quote, called the woodwork effect, which is about 750,000 people that were qualified but not signed up prior to the day. So the argument is false in this narrative because it would have cost the state of Texas taxpayers about $3 billion additional. You amortize that over your 10-year period, and you'd be in close to $300 billion. So, but I understand the need. But Medicaid expansion would have bankrupted the state even quicker than what you're advocating for helping on the local level. But I don't know where the narrative's coming from, and I appreciate the correlation, but it's misdirected, and Texas is going to look back at not doing that, and already has seen the results of not doing that as a positive thing, as those states that did it are hoping and wishing they can get out of it and are choosing that path.
Mr. Chairman.
Miss, ma'am,
Sure. Dr. Rip, I appreciate you coming here. And I assume that you want to see Texas accept Medicaid expansion to reduce uncompensated care and to cover more people who are currently not covered. Is that correct?
That is correct.
Okay. So you perhaps are not aware that 4 different states and approximately 2,000 expanded Medicaid, those states being the states of Arizona, Oregon, Delaware, and one more, which will come to me in a second. Those 4 states had approximately the same experience. I'll use Arizona as a specific example. So they did Medicaid expansion with Prop 204 in 2000. Their Medicaid rolls went from 10% of the population to 14% of the population over a 1-decade period. Their people who on private care went from 58% of the population to 54% of the population. So for everybody you put on Medicaid, every percent of the population went up. The private care went down. So the total number of people in the state of Arizona, or the percentage of population that was not covered, that had no health care coverage, stayed the same. At the same time, the state had an incredible cost. In 2000, when people were voting on Medicaid expansion, they thought it would be $600 million per year for the state of Arizona. In fact, it was $2.4 billion. It was a 300% increase in cost. And uncompensated care increased, I believe, about 150% in that 1-decade period. So by the metrics that you're hoping for, and I think we all hope for this, for more people to be covered, for there to be less uncompensated care, the 4 states that did Medicaid expansion in the 2000s all had pretty much the same experience of higher costs, less care, and the number of uncompensated care going up, and the number of people who did not have coverage stayed essentially the same in all 4 states. Clearly, Medicaid expansion was a failure, I would say, in those 4 states, and I don't know why anybody would want to copy that example.
Can I comment?
yeah, I'll give you just 20 seconds.
Okay. Unfortunately, we would disagree. 31 states, United States, have expanded
Sir,
Medicaid.
sir, you can't
States
you
that have
can't
expanded-
disagree.
Gentlemen, that's enough. Sorry. I mean, with this, you're welcome. I'm sure Chairman Shorten will welcome you to the Health and Human Services Committee because I think both Senator Perry and Senator Taylor are on that committee, and that's why they're so well versed in it. I appreciate your time. I've got to move on for the sake of everybody else that's waited so long. Ms. Burrell, do you have property tax discussion, or were you going to?
Well, I have something to say about property tax. Thank you for
Please.
the opportunity. My name is Lamla Barha. I'm also a top member, not a staff, not a paid person to present this. I am a resident of Dallas County. I have property. My income, my property tax is 25 to 30% of my income. That's not the issue. I own a property. I do get services from the city and the county. Part of my property tax bill states some of it goes to Dallas County Hospital District. That tells me I am paying for someone who's not able to pay for their care. So the fact that we're bringing health care into the picture should say that there is some mismatch here. We're paying for something that should have been taken care of to begin with. One, the fact that people are waiting for service for 3 to 6 months in county hospital makes them less productive. By the end of the day, we pay for higher care, higher price for the care that could have gotten lower to begin with. So my property tax does get affected by those who are not getting basic health care. The fact that there is trillions of dollars in federal government debt has nothing to do with specifically Texas alone. It includes the 50 states. So why are we paying with our federal income tax for other states to take advantage,
Ms.
to
Burrell,
take care of their
Ms. Burrell,
people,
I'm
and we're not
sorry.
taking care of it?
I'm just not going to allow this line of testimony at this point. I've got dozens of people that need to testify. It's already 4 o'clock. Again, I'm sure Chairman Schwartner will welcome you at Health and Human Services Committee meeting where we'll debate that. And because our charge for the hearing is property tax reform and relief. And while I understand your point, I cannot spend this amount of time when I've got so many other witnesses that have waited 8 hours today. I'm sorry for the outburst here. It's understandable if she waited 4 hours, Most of us have been here for 8, so I appreciate it.
Well, we all have. We have been here for about 8 hours as well. That's my property tax bill includes Dallas Hospital District payment as well. So what I'm saying is this. I've already paid federal taxes. Part of that federal tax that goes from my paycheck is going to Medicaid expansion to other states. Why aren't we accepting that so my bill on my property tax could go lower?
No.
I'm not complaining that I'm paying. I'm getting services for it. But if we're talking about lowering payment on property tax, maybe we can look into more efficiencies besides rates. Maybe utilizing other sources to cover our expenses. That way we don't have to come out of pocket so much. But thank you for your time.
No, thank you.
Appreciate the
No, I
opportunity.
appreciate it. I was trying to get you guys in because I know you had to leave. I
Thank
appreciate
you.
it. Thank you so much.
Thank you, Chairman.
No, thank you.